If I had to say something directly to HIV, I would have to say that you do not define me. That's what I would say. I would tell a person who is HIV positive, either newly HIV positive or a person who might have been in care before, just all the wonderful advances that have been made when it comes to HIV/AIDS, especially HIV, and that actually it's no longer a death sentence that it used to be. When I was first HIV positive, I was full-blown AIDS. The time was very different. The medicines weren't as good as they had now. I weighed 70 pounds. When I first saw myself in the mirror, I cried. Again, it was different back then, but it was very devastating for me. I first got into medical care because they didn't really know what was wrong with me. The HIV was hiding with another symptom and condition. So I kind of ended up in an emergency room situation. And finally, after that, a doctor from University of Miami came in and did the work and diagnosed me of what it was. And since taking my HIV medicines, I've maintained really good numbers, both with my CD4 and my viral load, which is undetectable. And since then, I've stayed in care and remained in care. If I was talking to a person who was just recently diagnosed and they were probably very afraid, I would want to break it down in simpler terms as to what the viral load is as far as the amount of HIV per unit in your blood. But also I'd want to be a little bit more compassionate and explaining to them that it's going to be okay. It's not the end, it's just a new way of doing life, and it's not a death sentence, and that they're going to be okay. Well, as a transgender woman, it's important to me because when I was first diagnosed, accessing care was very difficult for me. And a lot of the work that I do is helping or setting up at conferences free HIV screenings, STD screenings, and things like that across the country. As a person with HIV, living well means just on every level, my mental health, my physical health, eating right, exercising, living life knowing that I'm going to live, and that just making the most of it. HIV treatment works. Get in care, stay in care, live well.